All right, we are live with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey, joins us today. Thank you again, Doctor, for joining us once again.
My pleasure, as always.
My name is Dilshad Burman. I'm a web writer with City News and 680news.com, and I will be moderating this chat today. As every week, we get tons of questions for the doctor, but if you haven't had a chance to submit your questions, you can do so under this live broadcast. We will try and get to as many questions as we can. Whether they're back to school related or COVID-19 related, we're going to try and answer all of them. So let's get started, Doctor. Lots of back to school questions this week because, of course, many are returning to school. So let's get started.
Okay.
Okay. Let's start with Christine. Christine and Sharon actually have a similar question. Can you give your thoughts on kids wearing their masks on lanyards? I fear this is a big transmission risk, yet many parents are buying them and stores are promoting them, basically hanging the masks around their necks.
Okay, so there's a couple of things related to lanyards. One is that you want to make sure that the lanyard itself doesn't get contaminated, which it will. And so if you're going to use a mask with a lanyard, the same way that you wash your masks and launder them every day, you would have to do the same for the lanyard.
Right.
And the other thing about a lanyard that you have to consider is just like when we wear lanyards for our name tags, that it has a quick release because as well, it could be a choking hazard. And so that's one thing, but actually physically having it for the mask, again, it will have to be laundered and cleaned. And that's the biggest infection control risk that you'll have to consider.
Okay. And then a couple of questions about passing on COVID as far as kids are concerned. GJ asks, we are a multi-generational household. My parents are in their 70s and my 6-year-old kids reside in the same house. How safe is it to send the kids to school? And also, what extra precautions can we take as a family?
So deciding to send your 6-year-old to school, one of the considerations you will very legitimately have to make is that you have a multi-generational home with older adults living there. And there is a higher risk for them. There's no question about that. Because they're actually sharing the home with you, it's also going to be very difficult for you to keep physical distance between the 6-year-old and the grandparents. But that's a type of, you ask, what kind of added measures can you take? Well, if the children go to school, at least for the first few weeks when we try and sort through, well, how much infection is actually occurring in schools, you may want to keep your children as much as you can 6 feet distance from the grandparents. Wearing masks at home is another consideration. Some of that may not be possible or may not be practical. And so one of the other considerations is whether, online schooling is a choice and something that you would also consider in this circumstance.
Okay. And then Audra asks, if my child has a rare autoimmune disorder and severe allergies with anaphylaxis, would you recommend distance learning, online learning?
I think it's best for you to ask those questions of your healthcare provider who will have the ins and outs of it. Anaphylaxis itself, allergies itself, not necessarily at higher risk related to COVID. We haven't necessarily seen that someone who gets a COVID infection is more likely to have allergic reactions. But something that has an immune compromising condition, again, it depends on the type of condition. It depends on the type of immune system that's impacted, whether you would be at higher risk related to COVID or not. There are certainly some pediatric conditions that don't put you at higher risk. And so I think it's really good idea to talk to your specialist or your doctor about their recommendations.
Absolutely, because there's so many individual differences, whether your condition really puts you at risk, whether you're okay, it's just allergies. There's so many different things to consider. I don't know if there's a catch-all solution for everybody.
Yeah, and the other point is that sometimes the condition itself could be fine, but you're on a medication, and it's the medication that puts you at higher risk.
Yes.
So all of those things need to be considered. It is complicated, and so I definitely recommend, though, that you get the best advice from your healthcare provider.
Right, absolutely. And then Brett asks, what are the top precautions we should be telling our kids beyond the obvious ones and the ones that we talk about all the time?
So I think physical distancing is, that's the measure that we know works. And that's the one, though, that they might not always be able to keep. So I would say top 4. physical distancing, wash your hands often, wear a mask, and stay home when you're sick. I mean, we have a laundry list of public health measures. So I take your point, but if you had to narrow it down, those would be the four that I would narrow it down to.
Okay. Okay. And those are the ones that we have been talking about, definitely. And I guess they can't be stressed enough, right?
Yeah, and I think it's, so you see on my list, it doesn't say take a hand wipe and clean your surfaces every hour. That is not a priority. For example, there are ones there that are important, but if you had to dwindle it down, I would say those four.
Okay. Okay. And then this one just comes from Mom. Mom asks, are students expected to get a COVID test every time they have cough, cold symptoms? How about going to the doctor? How do we determine whether it's cold versus, something that's going to send us to get a COVID test?
So there are a lot of symptoms that can cause COVID. Some of them are the respiratory symptoms that can mimic a cold. Some of them are even vomiting and diarrhea as well. And unfortunately, without a test, you can't say clinically, oh, this is not COVID. Now, if, however, you have a runny nose because you have seasonal allergies, you treat the allergies, the runny nose goes away, and you're very confident that that's what's causing it, especially children that may have a chronic runny nose. Well, no, you don't need to get tested in that way. So what we're saying is if you have an alternate diagnosis, meaning you're sure that it's something else that's causing it, well, then you don't necessarily need a COVID test. But if we can't be certain whether it is COVID or not, the recommendation is that you do get a test. If you get a test and your symptoms go away, you can go back to school within 24 hours. But if you don't get the test, we don't know if it's COVID, and you could be out of school for 14 days.
Right. And I mean, that's the whole point of testing, is to find out whether it's a cold or whether it's COVID, right? So.
Yeah. And there's one thing that COVID has shown us is that, some of the symptoms can be very mild, sometimes even no symptoms, but some of those mild symptoms, actually people have gone on to get COVID and to spread it to others. And so we really can't take chances. We can't give the benefit of the doubt when it comes to this virus. And that's unfortunately why we are very heavily dependent on testing to diagnose the cases.
So the recommendation then is that, they get tested every time they show these symptoms?
So I think definitely the first time you get the symptoms. Now, you can't go back to school until your symptoms have resolved, unless, we can say, well, that runny nose is from allergies. It's not from a viral infection. Mm-hmm. I think if you continue to get repeated infections, well, this is where you have to have a conversation with your doctor. Now, you can always call telehealth. They can give you advice. A lot of doctors are providing virtual care as well, and can give you some advice that way as well, to let you know whether you need to have repeated testing done. Certainly, our goal is not to have kids lined up every week, at an assessment center. So there is a role for clinical judgment. But really, if we're not sure, the recommendation is testing.
Okay. And this is interesting. It's from Anonymous. It says, if you were making the choice, is it better to do virtual school first and see how the experience goes for the first month, or go back to school physically and then see how the experience goes in that sense, or, vice versa?
So I think that decision is extremely personal, right? If you have a child who will not do well at home and needs to go to school to learn for that social interaction, has really suffered maybe for mental health reasons from being at home, well, in that case, going to school, even though there may be more of a risk for COVID might be actually a lower risk, that you would take that risk because of the characteristics of that person. Again, it's also related to what's going on in your home. Do you have grandparents living with you? So I don't think that it's quite as easy to say, stay home, see how it goes, go to school, see how it goes. Like, it's a very individual decision. I even say the decisions that I have to make for my own children is not something that you can use for yourself. You're going to have to make your own decisions. What I would say, though, is there is no perfect decision. And so I think you just have to make a decision and go with it. There may be a time where in-person learning might have to switch to online learning because of the circumstances, and we'll have to be flexible about that. We also know that virtual learning, the school boards will have entry points when you can switch to in-person learning. So nothing is going to it's not like the decision you make is going to be till the end of June. Right. But right now, I would say make the decision that is the right decision for you for now as best you can, and then see how it goes.
Right, absolutely. Yeah, I mean, it's all trial and error at this point, I think, for a lot of people, whether the mental health benefits outweigh the risks of COVID. I mean, those are all very personal decisions that you have to make, like you said, based on your child and based on your comfort level.
Yeah, that's right.
Okay, and then we have a concerned parent. They ask, can public health shut down schools because they are not following distancing rules? Most classes have 25 to 30 kids with 30 to 50 centimeters between desks. Is this something that public health could do?
So we have provided our guidance to the Ministry of Education, where we do think physical distancing is a very important measure. And we know that school boards are adopting it as best they can. Now, where public health, so it's up to the Ministry of Education to provide that guidance back to the schools. Now, if there is a case in a school, though, that cohort, I want you to know that it's, the physical distancing is one measure, but there will be other measures in the classroom, like wearing masks, like keeping a distance as much as you can when you can, being outdoors as much as you can. Like there will be other measures, keeping the windows open, that will help to reduce the spread. But where public health can, quote unquote, shut down is if there is a case in a school. We may say everyone in the classroom has to go home until we can do a further assessment. If there's an outbreak that we declare in classes or in the school, in that case, we will ask in certain circumstances that the school be closed. So that is the role going forward that public health can do. The school boards, they do know what the measures are, and they do know what the guidance is, and they are following them. And I think, until the first day of school starts, until we see what the classrooms look like, we'll have to take it from there.
Right. Okay. And then James asks, in Peel High Schools, they're going with the cohort limited class size, but then they're filling buses to capacity and commingling all the kids. So whether it's Peel or whether it's Toronto, doesn't that defeat the purpose of the cohorts then, if they're going to be mixing around in buses anyway?
So on buses, again, the question is, how long is the bus ride? They should be wearing a mask. You can keep windows open on buses to reduce the risk as well. Again, some of these risks, you do the best you can, right? I mean, even when you go on the TTC, sometimes the physical distance is not optimal, but you are wearing a mask and washing your hands and not going when you're sick, all of those things as well. So I think what we have to do is use as many precautions as we can throughout the day, wherever we can. And I agree with you that the commingling, congregating, those are things that we need to really keep a close eye on, because that is part of the rise of our cases, is people are socializing, they're gathering, and they're not keeping up with their precautions. So my advice to you as a parent, to this viewer, is to say, teach your child your student, what they need to follow, that discourage the mingling, tell them to come home and mingle virtually, because those risks are not always in control with the school board. And I think each person needs to be aware of what they are and to follow them the best they can.
Definitely. I think so much has come down to individual responsibility, whether it's in schools, whether it's just us as citizens, in the city. Everybody kind of has to take that responsibility upon themselves. I don't know if as much as we want the school boards to take care of our kids, we want public health to make sure our kids are safe. Ultimately, there is a lot to do with personal responsibility and, teaching your kids or even yourself following all those rules so that you can stay safe and keep others safe.
Yeah, and I think, we're all in it together, right? So public health does what they can, the school does what they can, and then each individual has to do what they can as well. I would say, high school students, they want to have that connection. And so you might want to consider in your social bubble, do you have room in your social bubble for one or two of your child's friends? So they could have that close interaction, but it would be in the context of the social bubble. So right. I think there are things like that we can consider as well.
Right, absolutely. Let's see. Nessa asks, with regards to children with seasonal allergies displaying COVID symptoms, I think we just covered this actually, but again, will they be required to be tested for COVID at any site of symptoms?
So if the symptom is new or worsening, so you've had like you've had your seasonal allergy symptoms every day and now they're continuing, that's different. It's when it's a new or worsening symptom and you can't say for sure that this is what's causing it, that's when we need to consider testing for sure.
Okay, yes. And then this one is interesting because we've had this a couple of times. Emmy asks, how is it safe for various supply teachers to go from school to school? Wouldn't it be the same outcome that we saw with personal service workers going between different long-term care homes?
So the early in the outbreak of, early in COVID for personal service workers or long-term care workers, we did see that as a risk. They are now wearing personal protective equipment. And I think it's important that supply teachers too wear the personal protective equipment so that even if they are contagious at that time, their ability to spread it to others is low. I also do recommend that these supply teachers or teachers that go between different classes, that they keep that physical distance at all times. If possible, have a barrier like a plexiglass barrier or something to reduce the risk further because they are going to multiple classes.
Okay. And then Antoinette asks, lots of questions about class sizes actually. Antoinette asks, there are 30 children in my son's grade 11 classroom. Is that safe?
Well, in Toronto and neighboring areas, they will be having the adapted model. And so those class sizes should be in half. In other parts of Ontario, I don't know where Antoinette lives, in other parts of Ontario, they have not moved to the adapted model. And so they will have larger class sizes. Again, a class size of 30 could be safer if it's in a very large room. And, depending upon how the room is set up. So I think these are all questions that I would ask of the school or school board where you live, wearing the mask, like, again, all of those other precautions as well.
Okay. And then Julia asks, what does the government mean when they say they will aggressively test high school students for asymptomatic COVID cases? Are they going to be giving regular nasal swabs to my child? Do they need my permission first? And what happens if I say no?
So these are good questions. We too have questions on how this is going to work. What we understand is this is what we call surveillance testing. That's our medical term for it. It means testing people not because you think that they have COVID, but just to get an understanding how many people could be asymptomatic and have the illness. And so we understand that in high schools, they will be coming to do the tests. Most high school students will be able to provide informed consent on their own. They would be able to understand the reason for the test, to be able to consent to the test and do it. There is no age of consent in Ontario. And so, classically, usually around 14, you're able to understand the benefits and risks and make a decision. So I would have that conversation with your child. If you don't want your child tested, to make it clear to your child why you don't want them tested so they can provide that informed consent. I don't know what the model is going to look like, though, to say in high schools. And the idea is to find out in high schools, how many people are testing positive? What is the asymptomatic rate? So that we can, first of all, get on top of it to put control measures in place, but also to understand how much COVID is in the community. And so we're expecting more details, and parents too will hear more about this as well.
Okay. So you mentioned that they will be going into high schools, though. So that is going to begin at some point where there will be, medical professionals going into high schools, testing kids, that kind of thing.
Whether they'll actually step foot in the high school or whether they'll have a mobile testing unit outside the high school, but the goal is to test high school students more often with this surveillance type testing. And it doesn't mean that it's the same students who will be tested all the time. Right. It could be that we're seeing a certain neighborhood in the city that has higher rates of COVID and a few cases related to a school. Well, we may decide that those high schools are ones that are worth doing this testing on. Those kind of strategies may be put in place.
Okay. And then Amber has a related question. Is it safe for small children to be tested frequently? She says she's heard of cases where people have been tested and their blood vessels have been broken and, caused severe nosebleeds and things like that. So is it safe for little children?
So I do think it's important to say, and even for the previous question that the tests in children, you don't need to do the test that goes to the back of the throat. You can do what's called an anterior nasal swab. So it's just around the inside, just at the tip of the nose, and a throat swab. And so those tests are the tests that we are recommending be done. Because the deep nasal swab can be quite uncomfortable for children. And especially if you're getting repeat testing, the throat swab and the anterior nasal swab may be a better option. And so that option is there. The anterior nasal swab should not lead to nosebleeds.
Okay, good to know. And then let's see, Shamala asks, will the schools provide masks if kids lose their masks, especially the younger ones in kindergarten and such?
Yes, so the schools do have plans. Actually, we've seen the plans in Toronto, and part of the plan is that they have to be able to have a certain number of cloth masks or other masks available for students if they don't have them.
Okay, and then this one, we've got a couple of questions about teachers. Irene and Just Teacher asks, how do teachers keep at-risk family members at home safe?
So the best thing that a teacher or staff member in a school can do is to wear their PPE and wear it often. So teachers are being given, as I understand it, 2 masks. The masks are a medical grade mask. So as I've said before, that's the same mask that I wear when I'm in the emergency department. They're wearing in the school. And they can wear it with either a face shield or with goggles to give eye protection. You don't need to wear gloves. You just need to wash your hands often. You don't even need to wear a gown. So if you wear a mask and a face shield or goggles, then and keep your physical distance as much as possible. When you can't, then make sure for sure that you have your mask and your goggles or your face shield on. You should be very well protected. Wash your hands often. And the biggest risk actually in workplaces, including in schools, is the socialization that staff or teachers do with their fellow colleagues, and then they take the PPE off and they're having a conversation, and actually that conversation inches in, and next thing you know, you've spent 20 minutes close to face-to-face talking with someone without your PPE. So the best thing I would say, if I had to say one thing, is wear your PPE, wear it all the time when you're at school, and that will help you protect your vulnerables at home.
Okay. And then I think this is pretty much the same question, kind of related. A lot of emphasis is being put on how many people children interact with at school, but there's not much being said about teachers and their interactions and risks. So are we leaving teachers out of this equation? They say that they haven't heard a lot about how we're going to protect our teachers.
So again, teachers are having the ultimate protection with PPE. Students are wearing cloth masks, and that is the recommendation. Students do not need to wear face shields or goggles, but teachers themselves will. So by wearing that PPE, they're protecting themselves, and they're also protecting others as well. And so that is actually really excellent protection for teachers.
Okay. And then Rishma asks, how manageable will it be to have the smaller grades wearing masks and to wear them efficiently? Because little kids might have a little more trouble, dealing with masks.
Absolutely. And wearing a mask it's going to be a learning curve, and it's going to be difficult. And yes, they're not going to wear it properly all the time. And so, but they're going to learn, and they're going to learn how to make it comfortable, and they're going to see their peers wearing masks. And that's going to help as well. And so, between today and December, they would have had a huge learning curve on how to wear masks, just like learning how to tie your shoes or to even feed yourself, in kindergarten. That's a big milestone. So I don't think that we should expect perfection. It takes a while to figure out how to wear a mask all efficiently and all the time, but we can expect that some protection is better than no protection. And if they can, if they can't tolerate it, to take it off, that's fine. And maybe when they're taking their mask break, focusing on that physical distance will be important, or when they're outdoors, for example.
Right. And then Lisa has a concern. She says, we have a son with Down syndrome and he constantly has his hands in his mouth. Is it safe for his educational assistant and teacher to be using hand sanitizer on him?
So, I mean, the hand sanitizer itself dissolves. So as long as it's dissolved before he puts his hands back in his mouth, then the risks should be low. I mean, if you're concerned about the hand sanitizer, though, he could certainly wash his hands with soap and water, and that would be fine. So again, there's no perfect science here. And so we really, when you wash your hands with hand sanitizer, I don't know if you've ever eaten, sometimes the taste can be bad as well. So I'm not sure that he's going to want to put those hands in his mouth. But I think if you have concerns about the hand sanitizer, you can suggest washing with soap and water.
Right. Let's see, we've got John asks, there's been some reports that COVID tests are not as accurate in children, and that even if a test comes back negative, students with symptoms should stay home for 2 weeks. So should students with symptoms be allowed to return the day after they get a negative test, which is the current TDSB guidance, or out of an abundance of caution and the potential for false negatives, wait for 2 weeks to see if symptoms do appear?
So if you have symptoms and you get a test and it's negative, you can return to school 24 hours after the symptoms go away. Okay. Not 24 hours after you have the test. So even if you get tested, as long as you continue to have symptoms, you cannot return to school. You can only return 24 hours after the symptoms go away.
Okay.
Now, if, say on day 2, you got tested, the test is negative, but now it's day 7 and your symptoms have gotten worse. Well, actually, we would recommend that you get retested because that may be a negative test. But again, it's only 24 hours after the symptoms resolve that you can go back to school. And if the symptoms don't resolve, they get better, then we recommend that you consider getting retested.
Okay, so I think that's where the confusion is, that it's not 24 hours after a negative test, it's 24 hours after you stop coughing, sneezing, having a fever, etc.
Exactly.
Okay. And then it says, Sean has an interesting question. It seems like most of the planning that is taking place prior to reopening is around prevention of spread, but not much has been said about possible outbreaks. So in general, if an outbreak was to occur, what would a logical response look like in a school?
Okay, so we're actually actively working on that. And I spent the weekend working on materials related to that. So to say that there is a lot of work going on that there. I think what you can expect is if there's a case in a cohort, like a classmate in a class cohort gets a case, to be quick, immediately the class cohort will be isolated if the person was contagious while they were in the classroom. We then do a risk assessment. And what that means is that we try and figure out who did the person have close contact with. If it's very clear in the class that it was just one bubble of 5 kids who had close contact with that person, well, you can expect then maybe others in the classroom could go back to school. What about the rest of the school? Did they have contact with the rest of the school? So we will notify with letters, with fact sheets, and keep a close eye. What if we get another case? What about another case? And so you can expect to get a lot of communication related to cases in schools. Each situation is going to be different. And so while we have our principles in place, we evaluate every situation to decide what is the best measure for that school. And ultimately, it may include closing the school for a few days or whatever it may be.
Right. Okay. So there is definitely like plans in place when it comes to actual outbreaks in school then. And as you mentioned, it seems like there's multi-layered plans. It's not just 1 or 2 things or just simply shutting the school down.
That's right. And we have a whole school team of investigators who will be doing this kind of investigational work to provide the guidance.
Okay. And then this one comes, I believe, from a teacher. In terms of preparing to reopen, teachers are reportedly getting 3 days of professional development. Is this enough to make them experts in terms of COVID protocols?
So I think I'm still learning, and I'm a trained health professional, and there's still a lot of information that's rapidly evolving. I think as a teacher, what you need to learn in those 3 days of professional development is how do you wear your PPE and how do you wear it properly? That's the most important thing. How are you going to manage the public health precautions in your classroom? And I would focus on those 2 things. And then, know where you can get information on some of the other school protocols. What if you have someone in your class who develops symptoms? Like all of those things you can look up, you have time to ask. But those are the 2 things that I would really focus on. And don't think that you need to know everything about the virus, everything about what you need to control, because you will be able to ask questions as you go along.
Okay. And then this is an interesting one. We've had a couple of similar questions, so I'm just amalgamating all of them. Do you think that public health guidelines for schools reopening are stringent enough? And do you feel like parents can actually have confidence that the schools will take all of these safety precautions?
I can speak for the school boards in Toronto, who we have worked very closely with, that they have certainly taken to heart the public health guidance that we've provided them. And so I think, and we know that they are working on, traffic flow and sanitize stations and cleaning and, all of those types of things. Wearing masks, the protocols and the guidance is very good, and so I do have confidence in our Toronto school boards. I can say that. We haven't worked as closely with private schools, so I can't speak for every school. And I think the other piece is for them to teach their students the protocols, to follow those as well, is going to be really important. I think, that being said, even with all the guidance, and there will be cases in schools. And so we're not trying to implement all of this for 0 new cases. We know that there will be cases in schools. And so please don't think that when the first case is identified, the second, the third, now we're on case 10, that now it was a failure. The goal is to prevent spread in schools and to keep kids in schools. And I think that that's important distinction as well.
Okay. Oh dear, we're already out of time. It is now 1 o'clock. So I will wrap this up right now. We do have a lot more questions to get through, actually, but we'll save them for next week. Thank you so much again, Doctor, for joining us and for answering all of our questions.
Yeah, my pleasure. And I just want to wish everyone, a back to school, whatever it's going to look like for you and your family, as a teacher, as a parent. I'm sure there's a lot of anxiety. We're always available to answer questions. You can always call us, Toronto Public Health, if you have specific questions. It's not an easy thing that we're all embarking on, but you know what? I want to applaud everyone for their courage, and I'll see you all next week.
Absolutely. Thank you. And happy back to school week for the people that are going back to school, and good luck with making the decision, for sure. Okay. Thank you, Doctor.
Bye-bye.
All righty. Bye-bye.